Grüß euch miteinander, bin auch da.
Sehr schön.
Ups. Sieht immer so witzig aus, wenn alle noch auf ihren Bildschirmen umsuchen, wo sie was müssen anklicken.
Genau. Sehr schön, dass alle da sind. Ich glaube, wir sind fast vollständig. Kann ich schnell von der Regie wissen? Haben wir noch Leute im Warteraum? Nein, es geht gegen noch rauf.
Nur noch einzelne, aber die lasse ich laufend rein.
Okay. Then let's start. Welcome at the Science Afternoon of today. A year from now, on March 16, 2020, the extraordinary situation because of the pandemic started in Switzerland. But we managed to stay linked, and I see that we are over 90 persons today joining to reflect on science, communication, and COVID. In June 2020, we were contacted by Sebastian Hug, CEO of swissnex India, and he had the idea of a joint survey to understand the impact of COVID-19 pandemic on science communication in India, USA, and Switzerland. He brought together different partners, swissnex India, swissnex Boston, Cité, the National Institute of Advanced Science in Bangalore, India, and the Swiss Academies of Arts and Science. And it was worked very well together and intensively. And the result was a survey which was started in the 3 countries at the same time. And now we are at the point where the results are here. And we have an event here in Switzerland, and we have next week an event in India to present and to discuss with the different actors. We are very happy to have here today with our Science Afternoon on the panel our President Marcel Tanner. We have Huma Khamis, and we have Subhra Priyadarshini, and Sebastian Hug as the initiator of this study. He is the CEO of swissnex India. Jonas Brunschwig, the Deputy CEO of swissnex Boston, Philipp Burkhardt, the head of Sciences Cité, and myself, I'm Claudia Appenzeller, Secretary General of the Swiss Academies of Arts and Science. And now I hand over to Jonas Brunschwig, who introduces you to this joint study. Thank you very much for joining us. It's really thrilling to see almost 100 persons who are able to come together, even if there are a lot of barriers right now. Thanks a lot. Jonas?
Thank you, Claudia. Thank you. And hello, everyone from Boston. It's a pleasure to be with you today and to share some of the insights from this survey that we conducted over a couple of months between the end of last year and early this year. We have collected a total of 165 insights from different science communicators, mainly focused in the 3 countries where we have conducted this survey, so India, the United States, and Switzerland. As you can see, we had the lion's share of respondents coming from India, with 43.6% coming from India, 33.9% from Switzerland, 22.4% from the United States. So a robust distribution among our geographies. And on the pie chart on the right, you can see that we also had some diverse professional backgrounds within the field of science communication, with nearly 25% researchers, almost 42% science communicators, and then 33% journalists. Now, what is interesting within this is that for Switzerland and India, there was a fairly broad distribution among the 3 backgrounds, while in the United States, we pretty much had exclusively science journalists respond to the survey. Our outreach to the research community and the science communicators community at large were not as successful. I guess one of the most interesting aspects that made this such a relevant topic is the skyrocketing scientific output related to the pandemic. The graph on the left side is published by Nature and just shows the sheer exponential volume, incremental volume of scientific output related to COVID-19, both in terms of peer-reviewed and pre-publication articles, which meant that there was a whole lot of new science to communicate about this novel situation that the world has been facing. And that came with a new set of challenges. And if you look at the bar chart on the right side, we can see that quality control, meaning how do we discern what is relevant to be communicated and what are the most insightful and timely insights coming out of this new scientific output, has been a significant issue for all three categories of communicators, journalists, and researchers. And unsurprisingly, a little bit more for the researchers, because of course they are the primary producers of this new scientific knowledge. So a very interesting first insight coming from just dealing with the volume. And I'm sure we can hear more about the specifics of that in the panel. Another relevant insight coming from across all three professions or three categories of professions and the three countries, looking at who do they trust? Who do these science communicators trust the most? Unsurprisingly, researchers and universities are among the most trusted authorities on scientific output, as you would expect. International authorities such as the World Health Organization are also ranked quite high, and it would be interesting to see if this were as high among the general public. My hunch is that the general public might have a little bit lower trust in international authorities. And then what's really interesting is that science journalists and communicators have a relatively lower trust in their peers. So they trust each other a little bit less than they do researchers in universities and international authorities. And then local public authorities, life sciences companies are trusted at a very similar level. And then influencers, columnists, and opinion leaders share the least amount of trust. Next up, I want to show you some insights specific to each country. Particularly, we're looking now at the use of social media in Switzerland here in particular. So this, we asked these communicators to share with us what platforms they use, whether they use them regularly or irregularly. You can see that almost half of the respondents in Switzerland are regular Facebook users and LinkedIn users. 80% are on Twitter. And Instagram is actually quite high for Switzerland as well, with 39%, and WhatsApp relatively low. And I'm going to click on this so that we can go to the actual website, and I can give a quick demo and encourage you all to actually go on the website as well, because we have this beautiful data platform where you can filter by country. So we're going to look at India now for the social media output. It just takes a second to load. So we have the insights for India here, and scroll down to the social media, and we can see what were the most regular used platforms on social media in India. You can see Facebook, 65%, so higher than Switzerland. Instagram also still relatively high at 35%. LinkedIn, comparable to Switzerland. Twitter even higher, and very interestingly in India, this is one of the most interesting insights on the social media usage, is that WhatsApp is very, very commonly used in India to communicate science. This to me is not surprising. I had done some research in the past years on knowledge dissemination, informal knowledge networks in the global south, and WhatsApp turned out to be a very, very used platform by people to share insights and connect with each other, which is not the case in Switzerland and the United States. Lastly, let's have a quick look at the US, where we'll see somewhat similar insights on social media usage. I think that the main difference, the main point that stands out from the US is a significant lower use of Instagram in relation to Switzerland and India, although again, in the US, we're looking at mainly responses from journalists and not other science communicators. But Twitter takes the lion's share here, with nearly every science journalist that we have surveyed in the United States being regularly active on Twitter. Let me return to the presentation. We've seen these two, and get to some of the thorny issues that have come out in the survey. Fake news and the role of politics in the pandemic have emerged, according to our survey respondents, as some of the key issues that they had to tackle, some of the key challenges that they faced. So in this bar chart here, you're looking at the negative role that misinformation and politicization has played across the board, across all survey respondents. 68% of our respondents agreed that misinformation has played a very significant negative role, and 47% agreed that politicization has played a negative role. Now, if we break this down by country, it gets really interesting. You can see for Switzerland, misinformation, 66%, for India, 63%, for the United States, 81%. So the United States on both misinformation as well as politicization has had a significantly stronger negative impact among the science reporting community. I guess it's relatively easy to figure out why the Trump presidency was quite controversial in this sense. And the science community has faced an added burden and struggle to deal with that. And I want to go back to this headline, particularly the one on the right, with Biden just, I believe, about a week ago, using some quite heavy and decisive language in defining Neanderthal thinking, the decision by Texas, Mississippi, which has since been followed by other states, to remove the mandatory mask mandate and to essentially fully open up their economies. Now, the question is, where do we go from here? Of course, that is something that will be discussed in a couple of minutes in the panel, but I also want to direct you back to the website that was shared, because we have also produced some targeted knowledge and insight pieces, interviews with experts and leading figures from both Switzerland, the United States, and India, on their take on how COVID-19 has impacted the science communication field, their community, and their work. And we have some really great pieces of insight with written interviews as well as recorded interviews. We've posted one very recently with Mike Schäfer from Switzerland, who many of you probably know from the Science Barometer in Switzerland, and would encourage you again to visit the website and check those out. And with that, I want to wrap up this short summary and thank you all for your attention, and pass it on to Sébastien Philippe, who will now moderate the question and answer.
Thank you very much, Jonas, and good afternoon, everyone from Bangalore. Let me first thank Claudia and the Swiss Academies for Arts and Sciences for providing this excellent platform to present our project. My name again is Sebastian Hook. I'm the CEO of swissnex India here in Bangalore, where it is currently about 30 degrees. If I'm sweating, it's only because I'm wearing the jacket, and so please forgive me. But very happy that we can make this happen. Before we start with the panel, I would like to actually ask you also another question and launch a little survey and take the temperature in Switzerland among you on how you see the future of science communication in the context of this pandemic. So I'd like to ask Caroline to launch the survey. So there you will see the one question with the three answers. So will the pandemic strengthen the place of science communication in our society? Are you optimist? Or will polarization and fake news weaken the credibility of scientists and science communicators, or science communication in general? So you can be either an optimist, or you can be a skeptic, or you can be very Swiss and be let's not get too excited about it and be quite neutral, to play one of our stereotypes. So I'll let you answer that, and please click on submit. And then we will present the result of that mini survey at the end of that panel. So let me, in the meantime, present to you today's panelists. First, I would like to introduce Marcel Tanner, and I'm pretty sure that he doesn't need any introduction, but for those who don't know him yet, Marcel Tanner is the president of the Swiss Academies of Arts and Sciences. He's the former director of the Tropical and Public Health Institute in Basel. And he was also a member of the COVID-19 Science Task Force heading the expert group on public health, though he stepped down with the reorganization back in January. Second, we have Ms. Huma Khamis Maiden. She's a science journalist at the Radio Télévision Suisse and the vice president of the Swiss Association of Science Journalists. And last but not least, we have Subhra Priyadarshini. She's the chief editor of Nature India, and she also supported a project with an interview that you can read on this platform. So the panel will be moderated by Philippe Burkhardt, who is the director of the Foundation Science in Cité, and myself. If you have any questions, feel free to ask them in the chat on a rolling basis, and we will try to address them if time allows. If not during the panel, then maybe hopefully at the end. So I think, Karen, I think we can stop the poll, or I will close the window here. And so heading or giving over now to Philippe to start the panel.
So hello, everybody. The title of today's event, Has Science Communication Failed?, is of course a little provocative and can probably not be answered with yes or no. To start our discussion, let me rephrase the question and ask each one of the panelists, with 1 year into this pandemic, what are your personal lessons learned? What are some of the things you would do differently today than a year ago in terms of how to communicate the science behind COVID? The question goes to all the three panelists. Marcel, would you like to start?
Yes, I was waiting for that. That you indicate who should start. So thank you very much. I'm very happy that we can have this exchange. Thank everybody for bringing us together. And I would also say, what did we learn? I mean, first of all, I'm glad that you rephrased the question, because one of the biggest problems that we have in science communication, and that is then picked up also wrongly, be it by politicians or by the population and the media, is actually that you create false dualities in a way that it failed, yes or no, good or bad. And I think this is not the case. As you know, the academies have always been very sensitive in order to really get communication right, in a way that we are really only as scientists making policy relevant statements, but no policy prescriptions. That's a sentence that for a long time we have held high. The COVID situation has shown that we have to do more in order to really keep this important interface, that the science presents science, what we know and what we don't know, but does not make any prescriptions. And I think what we learned, if you ask Philip, we learned that we have to be even more stronger in making this distinction, and that as a scientist, in a way, in the communication, we don't become activists, but we remain scientists and provide the evidence and also what we don't know. And we show what out of this knowledge and what we don't know, what options one has for actions, but not the prescriptions for actions. And this is actually something which we experienced very clearly in the work of the task force. And we experience this very clearly now in the work that we have to take back into the normal life, that we have to be much more precise and also make this clear to the media, because the media, and particularly also, I mean, not to enter this discussion, but the social media and this superficial situation is not good for science communication, because this leads to headlines and statements that could be read as activist statements, but not as scientific evidence. And I think this is something which we learn, that we have to really deepen this understanding what we can and what we can't do as scientists in order to remain credible in the political as well as in the public discussions. And finally, it's also something what we learn is how we interact with media. I mean, a lot of my contacts and a lot also before COVID were positive interactions with the science journalists or with the journalists as a whole. The problem are the ones who make the paper at the end, who make the headlines, which you never can actually control. And that's where the nonsense happens, where a lot of actually good information is destroyed by somebody who wants to attract the media or his journal by a nonsense headline of somebody demanding something or somebody actually showing something. And the headlines are full of half-truths. And as you know very much, half-truths is the worst in communication to handle.
Thank you very much. So we could probably switch to India. What's your situation? What are your learnings, Subhra?
Thank you. I think we've set the right note with that headline and with a very provocative preamble by Marcel, who says there's a lot of nonsense going around in headlines. So this is a classic case of what a scientist thinks and what a journalist thinks differently, right? And this is where we need the bridge, really, between scientists and journalists. And this is where communication really comes to fore. So I think that's a great beginning to make on the panel. I would go directly to your question, Philip. The lessons that I personally learned in India is triaging the flood of stories, you know, picking up what's most important and more importantly, leaving out what is not so important. Because you saw from that graph that we just saw, the number of papers, scientific papers was just shot up like nobody's business, right? And we had so many papers coming in, preprints, manuscripts, and as science journalists and communicators, it was really difficult to keep pace with that volume, that tsunami of stories, you know. And so the triaging is something that we learned over a period of time. It took us a couple of months to find our balance of which story to pick, which story to leave, etc. So that was one thing. The second one was scotching misinformation in real time. Why that was so important. We couldn't wait for 3 days to scotch a piece of misinformation because by then, as you saw in India, WhatsApp was flooding everybody with those misinformative stories. So you had to do that scotching in real time. You couldn't lose time. You didn't have a shelf life for those kind of stories. So those were something that things that we learned. What could we do differently? Obviously, not to believe all the data that is coming your way, even from purportedly authentic sources such as governments. As we know by now, that the pandemic takes all kinds of colors, economic, social, political. So fact check, fact check, fact check. That's what we really learned, something which we should be doing differently going forward. Striking that elusive balance between work and life. You know, it was just a continuum of work and we didn't know where to stop working. Days would melt into nights, nights into days. We had very little sleep. So that's something we should do differently because it tells upon journalists and communicators' physical and mental health. I'll stop there and I'll take more things later.
Yeah. Thank you very much. So Huma, Khamis, you are also a science journalist. Please, what are your learnings?
Well, it's true that fact-checking was a lot of work during this period, and it took us a lot of time. But what I noticed also is that it was somehow the end of the honeymoon between science and society. Because BC, before COVID, the general public was more or less convinced that scientists knew everything. And maybe this was a mistake from us journalists, but also from scientists, to be always so affirmative about scientific facts and not to communicate about the doubt. So I guess one of the things I have learned is that we have to keep saying that science is an ongoing process, and that the truth from today is maybe not true anymore tomorrow. So that was the sad news. It's the end of the honeymoon. But the good news is that now we can start a real relation between science and society, and we know how we know each other better. And what I learned also is that nothing is too complicated in science journalism. I remember in March last year, we were wondering if we could talk about R0 in our show, in our broadcast. And we were like, wow, maybe it's very complicated. And now everyone knows what R0 is. So the good news is also that the science literacy increased during this period. So yeah, there was good and bad. And I think we should really remember that scientists are human beings, as the others, and yeah, maybe they sometimes mistakes, sometimes they don't know, and we have to be brave enough to say that.
Okay, thank you very much. So for the next question, I would hand over to Sebastian, please.
Thank you, Philip. And that was an excellent start. And I think it had already answered some of the questions that I was going to ask. But so maybe the second group of questions on the role of scientists in the public debate, and I think Marcel has already alluded to it. I mean, obviously, we all know in Switzerland, there has been a lot of debate about the role of scientists, but also especially of the role of the COVID Science Task Force. How appropriate is it for them to not only give scientific advice and explain the science behind COVID to the government, but for some of the scientists also to publicly take a position on the measures taken by the government. In our interview that you can read on our website with Professor Mike Schäfer from the University of Zurich, he's an expert on the topic of science communication. He said that actually with the younger generation of scientists, there is an increased willingness to communicate about science, to take on more consciously a public active role or maybe even activist role. And of course, that tendency at the same time brings the risk of politicizing scientists and by extension science itself. So my question to Marcel Tanner, and I think you actually have already answered to it, so I'm going to rephrase a little bit. I was going to ask you, what is your take on the role of scientists in the public sphere and with respect to policymaking? So you said they shouldn't be activists, but would you agree with Mike Schäfer that it is basically a generational sort of development, a generational conflict between you know, I would say maybe old school scientists and the new generation of scientists?
Thank you very much, Sebastian. No, I don't think that this is a generational thing. I was very surprised to hear this statement. I think it is the point of how you understand your science that you do. And it is the question of how you bring it in. I very clearly maintain the position, which is not the position coming up now, but for a long time with all my work in different systems and cultures, that you never should actually act as an activist, as a scientist. If you want to bring in your voice as a scientist, as I said before, you make policy relevant statements, you show options for actions, but you are not politicizing them. I mean, I work in very difficult situations, not now only in Switzerland, particularly in African countries, Asian countries. This was the best way to get public health action going. If you remained in this position where you said, this is what we found, these are the people that are suffering, this is actually the option that you have for intervention. And you also say what you don't know. And with this, you could move many more things and having impact than changing yourself as scientist into becoming a public health activist. And I think this is a very important thing, which also gave credibility at the level of the population that you remain in this position. So I would think that we all, being young or older ones, actually should really maintain this part. And one thing which is behind is that the science culture, where people have to publish, have to have all this crap of impact and age indices and this nonsense, is actually stimulating people, what I have said already 1 year ago, that people, then many scientists look more into the mirror than they look out of the window. That means they have to actually perform in order to have a position. And that's the rotten science culture that we have, that individual efforts are much more celebrated than group efforts. And particularly in public health, that's my experience. That's why I say that this is an important issue. And I think this is something which we should bring into not only in the communication, but in the way how we structure our science culture, careers, and so on, so that we really can maintain our role of bringing in our knowledge, our expertise. And I think this is the last sentence I have. What is also a very bad situation is this statement of experts. I'm not much more than an expert than anybody else on the street. Everybody has knowledge and experience. Together, we learn, mutual learning for change. And so it is call of experts, people actually being somehow outside, is also falsifying a good process of transmitting science to the population and to the politics.
Thank you very much for this very clear statement. Maybe let's take now an Indian perspective on that same topic, and my question obviously to Subhra. In my view, being here in Bangalore, the COVID Science Task Force in India has largely been aligned with the Indian government, and partly or mainly because there have been members in there which are scientists, but also high-level government officials such as Dr. Paul and Professor Vijay Raghavan, who's the principal scientific advisor to the Prime Minister. But my sense is that even the scientific community in general has been largely behind the measures of the government, or at least there's no been strong public rebuttal of the government's action. So in your view, is that a sign that the federal government has close ties with the scientific community here in India, that they take their advice, or are there other reasons for that alignment, or am I simply wrong and there has actually been a strong opposition to the government?
Depends where you're looking at it from, really, because I do think independent scientists, healthcare professionals, and their groups have made strong rebuttals on most things that weren't logical during the Modi government's implementation of public health policies in the COVID-19 scenario. So be it the Sero survey results or introduction of certain drugs to treat COVID-19 in the earlier days of the pandemic, or some propaganda around Ayurvedic medicine to emergency use authorization of one of the vaccines that the government was part of creating, Covaxin. So there have been several instances of strong reactions of people and communities. In some of those cases, the government has had to step back on what they've done. Mostly they've stuck to their point, but in some of those cases, people and scientific community, they have really been instrumental in making the government see the logic of science, the reason of science. So I would say where you're looking at it from really matters. It isn't just the scientific community. Even people were not falling in line with any such behavior. Take, for instance, the use of Covaxin itself. So there have been several instances of strong reactions against, in the immunization program while it is still going on. I was on a panel day before yesterday about how well the immunization program is going on. And from a suburban state, suburban place in West Bengal, one of the eastern states, there was one doctor who came and said that, people were wary of taking Covaxin because it hadn't gone through the phase 3 trials and it was given emergency use approval by the government beforehand. But suddenly there was a spurt in the number of people who were opting for Covaxin last week because the interim phase 3 results suddenly were declared and they were like 80%, 81% efficacy. So you see, there is latent rebuttal at times. Even if people might not be saying anything, it doesn't mean they don't know. They are siding with where the science is in many cases. So that is what I would think is the scenario in India.
Okay, thank you for clarifying that. So maybe handing over now to Philippe again.
Yes, thank you, Sebastian. So the next question will address Huma Khamis, and it's about polarization and the problem of fake news. You were already talking about the fact checks, so that's a really important topic. So the respondents of the survey answered that the growing polarization in society poses a key challenge for science communication. This is true for all 3 countries where we have done the survey, but in particular in the US, as we saw it before. Professor Julia Marcus from the Harvard Medical School, who was interviewed as a part of our project, even said, I quote, I censor myself constantly. As a result, I tweet very rarely now. The more followers I have gotten, the longer the pandemic has gone on, the quieter I have become. So in a way, polarization is partly driven by certain media, also because polarization probably benefits the media. So the question now for you, Huma, would be, how do you balance the need to seek the reader's attention on the one hand, on the other hand, at the same time, consider the more nuanced and sometimes complex scientific results?
But I think that's all the purpose of science journalism, to be balanced. And it's all about finding the right expert. I know Marcel Tanner doesn't consider himself as an expert, but he is. And we have, if you have a background of science journalist, you won't go into these headlines. The problem is that there was not enough science journalists on, at least in Switzerland and in Romandy, when COVID started. So in the newsroom, people started to write or to speak about science, but it wasn't their field. And sometimes I had the impression, I always say I'm not able to comment a hockey or a cricket match in direct. So why should some non-specialized journalists be able to comment a pandemic in direct? That is happening. So I think in the same way that the science journalist chooses the right expert, maybe the expert also should ask about the background of the journalist he's speaking to, just to make sure that the information won't be misused. The other thing also is that in the early phases of COVID, the experts were busy and they were working, they were doing their job as experts. So it was quite difficult. And there was also a need of information for the public. So it was really a difficult balance. And yeah, if you are in this social media, that was really, really difficult. But I hope, and I strongly hope, that next time we will be ready also in the newsrooms with this kind of situation. And for this, we have to finance science journalism.
Okay, thank you very much. So I have a question for Marcel about the same topic, probably like the other side of the medal. How can scientists and science communicators avoid to become a victim of polarization? how can they avoid to be instrumentalized without having to self-censor?
I think it's I would say it is very easy, as long as I mean, also a clarification first on this whole task force issue that Sebastian mentioned. I mean, it was clearly stated as a task force, is one voice as a task force, but each individual scientist, as much as each citizen is allowed to really make a statement, and not in the name of a body like that that gives advice, but it's the question on how you do it. You can if you can avoid it by just honestly state what I said before. You state what you know and what you don't know, and you don't actually just I mean, the criticizing a measure that has been taken is not is really the wrong way. But if you really look at the task force, for instance, all the policy briefs, the written statements are very coherent. There's no cacophony there, and it is a coherent way of presenting what we have examined, analyzed, and compared. The scientists can avoid it by really just making these statements in the sense and the spirit I said before. And that last point is also something which I said before. I'm the one, not your Harvard professor that you cited. I don't tweet. I simply don't tweet because I don't think that science can be communicated by these sloppy, superficial nonsense sentences that are floating around the world, because this is really the way where we must be more solid. And I think with this, we can avoid polarization by not just throwing a sentence into the world, but be always ready and also talk to the skeptics and the deniers. And I have exposed myself in a way. I went to these public places. It was not very comfortable sometimes to discuss, but it is this way that you avoid polarization, that you have actually, and you listen to all the voices, and you make statements that you can always stand for, and you don't stand for just for giving a flavor to a current discussion, but being coherent with how you work as a scientist. And this is science culture again. And so nothing magic, very simple.
Okay, thank you very much. Very clear statements. So again, I will hand over to Sebastian.
Yes, and let's talk now about quality control. And Jonas has already referred to it in the earlier presentation. So according to a study published in Nature in last December, around 4% of the world's research output was devoted to the coronavirus in 2020. And more than 30,000 articles were preprint, meaning articles that haven't been peer-reviewed yet. At the same time, peer review processes for COVID-19 studies have speeded up considerably and took half the time of other studies used for peer review. So in our survey, we have asked, as you could see, we have asked the participants whether they see this development as a factor which might impact the quality of the scientific output. So it's only their perception. Obviously, it doesn't say whether it really whether the quality is really worse. So it's only a perception. And in the perception of primarily scientists we saw, they were skeptical about this trend, as well as journalists, much less apparently the science communicators themselves. So my question to Huma, Khamis, how do science journalists deal with this trend of more preprints? Do you consider this beneficial to your reporting, or is it rather a risk for you?
I think it's both of them. Of course, it's interesting to have a preprint and to see what is happening in the scientific world. But we really need to be aware, and science journalists know that it is a preprint that haven't been peer reviewed. So this could be really dangerous to share with the others. Usually, what I tend to do is to find another scientist to do this peer review work for my report. But it's really dangerous But I would say at least a preprint is something, because there have been also a lot of communication, only statement or press release without any results, without anything solid on which we could rely. So yes, it's normal that science accelerates, but we also have to be really clear when we communicate about this kind of result, which kind of result it is. If it is a preprint, we have, it's a question of being really honest, and we have to be honest and say, this is a preprint and it has to be reviewed. And the public discovered this process of peer reviewing. I think nobody was ever aware of that before COVID. So yeah, it's good and bad, but it was a lot of publication. I mean, yeah, it was really a lot of work to go through.
So let's ask the publisher, and my question to Subhra, as the chief editor of a leading science journal, what your experience has been. Will, in your view, the pandemic have a lasting impact on the peer review system in terms of speeding up the process and the science publication business in general? How do you see that?
Preprints, especially when the science is fast emerging, are a great thing, I think. It's just like fast tracking your vaccines. We never had fast tracked vaccines earlier, and we had so many vaccines produced in just 1 year. So I think there's been a tsunami, as I said, of scientific literature around COVID-19 and SARS-CoV-2. There have been some high profile retractions of that kind of scientific literature too. But by and large, I think it has been a stupendous amount of science and publications, and that's quite healthy, I would say. Now, out of that mountain, you would be able to pick at least the best science. And as science journalists and communicators, it really is upon us to sort of separate the grain from the chaff and to sort of see which preprints really merit the highlighting by science journalists. So with preprints, we know that they are yet to be peer reviewed. And so our policy at Nature has been that we do report on preprints, but we make sure that we inform our audience the fact that they are not peer reviewed, that they have to yet undergo that process. And that is a crucial communication. That is something that needs to go out. At the same time, as Huma pointed out, it is upon us to figure out, to do our own little peer review, to sort of get to those experts who might know better than us and to vet those preprints via them. And I think preprints are really, really healthy. They are a trend that is going to last for a long time. Most of us have come face to face with preprints now. And I do think that we will evolve, just like publication of manuscripts and peer review has evolved over the years. The fact that preprints need to be even more robust, despite the fact that they are not peer reviewed, will also evolve with time. It's a good time to start thinking about that.
Thank you, Subhra. And maybe as a question to Marcel Tanner, like what is your take on this development? And do you have any indications that this rush for quick results has affected negatively the quality of the research on COVID-19?
No, as I would say, it is not negatively affected, but it has actually made it more difficult. And that actually then goes into the quality issue. And what we really know is the sheer mass of information we get. And the way is also, as we had to produce vaccine or getting to registration more quickly. By the way, Subhra, it's not the first time. These rolling procedures actually came out of work that we did ages ago in malaria and later on with Ebola in order to think of processes. And it is not only came with COVID, because in COVID we were ready, before we were not ready. So it is the same thing with for these things that we must think of a different process. You see, I confronted in editorial boards of journals for years. I mean, the issue is that you must change the process in the way that Huma has also said, that we have to do our own peer review and so on, but we have to just not send it out to people very often very specialized. I use the word silo thinkers, but top experts in the field. But in such a situation that we are in COVID, we must actually send it out much more to people who have a broader view. Many of the findings which came out in COVID needed not only an immunological assessment, but it needed also a public health dimension in order to see the link between societal, the social tissue, and economy. So therefore, the change of process is that you actually go at colleagues who have a broader view, not only just as a view, but also have expertise and experience, down to earth experience. Not only send a modeling paper to 2 other modelers, but you send it because who have never have dirt on their shoes and have never seen a patient. And actually then send it to people with a broader view. That has changed the peer review process, and that helps you to position a scientific finding into a broader context of a problem that we have to solve. And I think this stimulates us, and that's what we learn when we have such a massive production of scientific evidence, that we actually set it into another peer review process where we set it into the context of a society, of a country. So for instance, also that you also take a finding from let's say from India, you not only send it to US reviewers, but you send it to somebody also who knows context in order to see in what context actually a complex finding was on how migrant workers and poverty and so on has affected the economic output. This cannot be looked at by a Swiss economist or by a US economist. And I think it's the process of peer review that has changed and must change, as we did with the development of vaccines.
Thank you very much. I'm handing over to Philip to the last 2 questions. If anyone in the audience has questions, we have, I think, 8 minutes left, so I'm not sure we can address them. But if you have a burning question, please do put it in the chat, and we'll try to address it. Philip, over to you.
Thank you. So let's try to look into the future a little bit. I have a question for Huma, Khamis. Resources of science journalists have been cut drastically over the last decade. One of our survey respondents said that there is actually a lack of scientific understanding in the editorial rooms of Swiss media houses. So what's your opinion with this pandemic? Will we see the tide turning in science journalism? Can you expect more resources or at least more acknowledgement for your work?
I would like to be optimistic, but I'm not. I'm
Okay.
sorry. We have seen the last 10 years the number of science journalism dropping. It's not a topic that it's very difficult to live from this specialty. And on the other hand, there will be economic consequences of this pandemic, and some cost cut. And I'm quite sure that in the same way it happened the last 10 years, the science journalists will suffer from that, as well as other journalists. But we reach a point where everybody spoke about the pandemic, so we think everyone can be a science journalist, which is clearly not true. So no, I'm not very optimistic. The other thing is also that scientists and university and PR did also a great job during this period. So one might think that, yeah, that's enough if we let only the spokespersons from the university and academies lead this kind of questions. But we have to remember that PR is a PR and will defend its it's university, it's job. So yeah, I'm not very optimistic, but we have to be aware that we will need science journalists, because it's also a specialty. If you don't practice it's like skiing. If I don't practice it, I'll forget it, and next time I might fall.
Okay, thank you. So for Marcel, I know you have to leave very soon afterwards, but perhaps a short statement. What do you think? What is the effect on the community in Switzerland? Can science communicators in universities expect more resources or more recognition for their work?
Certainly they can expect more recognition. I mean, I would say that particularly at universities and in our different bodies, science communicators have done a very good job. Also the ones that were at SRF, for instance, they did a really good job, basically. And it has shown also the crisis, and that's where we as an academy, we are really voting for that there is an increase in support for science journalism, because I have seen over the decades, see how this went down, and how media have actually cut on science journalism in a very major way, unjustified. And some of the problems that we discussed had to do with this decrease. And therefore, I'm very much convinced that not as a single injection of money, but actually with our science culture effort that we undertake at the academies, we want to really support science communication and not propaganda, science communication. And we want actually to support that the media recognize the essential positions, because if the media do a scientific assessment of the performance during the crisis, they would realize that they would need many more science communicators and journalists, particularly also with the crises ahead, that we have to look at climate, gene technology, biodiversity, you name it. It's everywhere where science communication becomes more and more important. But I'm committed to make here a strong move to get this going.
Okay, so finally, a last question from Sebastian to Subhra.
Yes, a very last question, Subhra, just maybe in 1 minute on the role of social media. We have seen increased role, and Marcel has commented on it already, actually. We have seen that there is a harsher debate on social media. What is your view on the effect of social media on science communication, and also on the debate between scientists, among scientists themselves? What are the risks of this dominance of social media, and how could these be mitigated? Maybe just in 90 seconds or 2 minutes.
Sure. So you have seen already the graph again, the bar that you showed from India on Twitter. You know, I think a lot of scientists are on Twitter during the pandemic, at least they were, and they benefited. That's what they tell us. They benefited immensely from being there, primarily because they could network. They could talk about their science with one another. There are several other ways of networking, but I think the real-time factualness of the real-time networking on Twitter. The principal scientific advisor is on Twitter. He answers so many questions on Twitter by anybody who cares to ask him, etc. So I see this two trends happening during the pandemic in India. One was the fact that there's a slight difference between what Huma and Marcel have said about science communication and journalism in Switzerland than in India. In India, I think it's a pretty optimistic scene right now, with lots of people getting interested in journalism, as well as the government itself getting interested in creating a space for communication. For the first time in the history of this country, the Science, Technology and Innovation Policy has a separate chapter on science communication and resources that can be allotted to it. So it's a huge thing. And similarly with social media. I think I mean, there are harsh words to be said about social media, but I do think it does have, Sebastian, like you pointed out, a generational thing, and also something that younger people are embracing without any thoughts. The flip side of it, especially for women, is you can get trolled like nobody's business. And science journalists have been trolled, especially women again, and they've lost sleep over that kind of trolling. So bad sides to it as well.
Thank you, Subhra, and I'd like to thank all the panelists. I think especially Marcel because he has to leave right now. But to all the three of you, thank you so much for sharing your insights, your views. I think it's been extremely insightful. I hope for all of us. So a big thank you. And if we would meet physically, I would have some some gifts. But so I'm sending some virtual gifts to you, or at least some hand clapping there. So thank you so much. We have now the results, I think, of our survey, and so let's see. So a little bit over half are optimists. So I think that sets a very good tone, I think, to end this this webinar. So over 50% are optimists. We have about 70% of skepticals, and at least 30% Swiss or let's say neutral responses. So I think that sort of gives some positive echo to go forward. Again, a big thank you to all the panelists, to my co-moderator Philip, and of course to my colleagues from swissnex Boston and Claudia for providing this platform. So I will hand over to Claudia now to wrap this up, but it was a real pleasure to be part of this Swiss event from Bangalore.
Thank you very much. Thank you, swissnex India, swissnex Boston. Thank you to all of our partners, to the panelists, to the speakers. It was really great to work together and to see you again. And I would like to thank also to our great public who joined us with over 100 persons, communicators, scientists, presidents, past presidents. I saw you, Thierry. We also saw a lot of colleagues. I saw my physics teacher who was teaching me physics like 27 years ago. So it's really great getting together. Let's keep up. Let's get vaccinated and let's get out of this lockdown as soon as possible, but stay healthy in the meantime and be careful. Thank you for joining us, and hopefully we will get together at another appointment. Thank you very much. Have a nice afternoon. Bye.
Bye-bye. Thank you very much. Bye-bye.
Bye.
Bye, everybody.
Thank you very much. Thank you, everyone.
Thank you.